So I just want to take a minute and talk about, we're going to spend a little bit of time now on probably one of the most exciting aspects of what we're doing now, which is announcing a new partnership between the Brookings Institution and the Merkin Initiative here and the Khan Academy. What I'll pull up in just a minute is a video from Sal Khan. And you'll be hearing in this section from three people. Sal Khan, who some of you may know, a fascinating individual who has really revolutionized the education around initially mathematics and now so many more things, and delivered education to hundreds of millions of people across the world through an innovative series of tutorials. He'll be just joining us by pre-recorded video, and then we'll be hearing from Rishi Desai, who is a physician and who has I give him a lot of credit for realizing that this platform, which is so simple, it's somebody actually just doodling and explaining things, can be used to also explain very complicated ideas in medicine, particularly to medical students and residents who are preparing for some of the most demanding series of licensing and other exams. And then I'll close with a brief demonstration of what we're really excited about here at Brookings, which is our collaboration, which has just gone live to start to kind of deal with some of the gaps and address some of these needs in healthcare policy, and then ultimately to how to engage the public broadly in payment and delivery reform. So here's Sal.
I just want to say how excited I am about the partnership.
Can you make it louder?
Khan Academy is all about providing access to knowledge to anyone, anywhere, and healthcare is obviously a super important
I'll just start from the beginning so we can hear. One thing I'm always struck by with the Khan Academy while we're just working on the volume issues is the thing I like to emphasize is this is all can be fairly simple. If you can see, he's in his office there. You can see pictures of his kids over there as well. This is all done without spending millions and millions of dollars. It's really a testament to sort of the power of social media as well as innovative approaches to education. Are we good? Why don't you go ahead and
Hi, this is Sal Khan, founder of the Khan Academy. I just want to say how excited I am about the partnership with the Brookings Institution. Khan Academy is all about providing access to knowledge to anyone, anywhere, and healthcare is obviously a super important part of our lives. As a husband of a physician, I recognize a lot of the kind of issues people face, and just even understanding the system, understanding what their needs are, understanding how it fits into the big picture. And so I hope that this partnership with the Brookings Institution can move the dial in this regard.
Just want to give him some credit because he had to re-record that video several times because he kept referring to us as the Brookings Institute. So I'm going to go ahead and briefly introduce Rishi Desai, who's going to come on and join us by video from California live to talk a little bit about the history of the Khan Academy, its approach, and really how they are reaching people who are going to be physicians. And then we'll segue into a discussion about how we at the Brookings Institution will now be partnering with this platform to deliver some of the kinds of education information you just heard about earlier. So,
all right. Can you hear me okay, Darsha?
Yep. Let me just turn up our volume a little bit.
No worries. I'll tune down my voice a little bit. And can you see the background? Can you see the background slide?
We can. All right. You're. We're good to go.
So first of all, thank you for inviting me to be part of this. I was keenly listening in to the conversation, so it was actually quite interesting. And my background, as you know, I'm a pediatrician doing infectious diseases, and I heard about Khan Academy kind of the way probably a lot of the audience is hearing about Khan Academy. I just came across it through a social venue, and I thought it was quite interesting. I just put up the mission statement because I thought that a couple of these things jumped out at me. The idea is not-for-profit and free world-class education for anyone, anywhere. I mean, when you hear these things, it's pretty exciting, right? So, you obviously want to make sure it meets muster, and so I started doing some quick Googling, which is what I think most of us would do if we're interested in something. And the scale just kind of really impressed me, the idea that, they're reaching over 200, about 200 countries, 40,000 plus classrooms, millions of users each month, and the problems answered, and it's just astounding. And this is pretty impressive stuff. And it got me thinking about medicine, right? So I was thinking, well, how are doctors and nurses trained? And this is certainly a slide that we can all agree is decades old. But it brings up this idea that we've really changed, right? We've changed from this kind of a homogenous group of providers to something that looks a little bit more like this. We've got some folks doing advocacy and public health and research. And really, a doctor today does a lot of different things. I myself practice at Stanford, and half my time is getting patient education out there and making sure people understand what it is they're doing. And other parts of my job require that I work on grants. And so really a myriad of activities. And you think about our education model in medical and nursing school, and I could extend that further to pharmacy and dental and to all the other branches of healthcare education, and it's pretty stagnant. We're not really using these technologies that we have today. I mean, you could argue that the smartest person in the room that you're all sitting in is probably not any person at all. It's probably a smartphone, right? More knowledge stored in there, or information stored in there anyway, that we now have to learn how to access. So that's the challenge, right? Like, how do we actually figure out how to use these technologies effectively and not, lose sight of what the goal is, which is to train these very diverse providers. So that's kind of where I think Khan Academy steps in, and I'm just going to walk you through some of the aspects of Khan Academy that really excite me, that get me going. So there's this idea that it's personalized, and I'm going to spend a little bit of time talking about this. The idea that, you have these different folks coming into, let's say a medical school classroom, and some people may have really no background. They're going to step in, they're going to learn about the heart, they're going to want this video, just walks you through how the heart works. It's very basic, and the analogy to healthcare could be, just a very basic overview that Darshak puts together on kind of payers and providers, very, very high level. And then you get into the nitty-gritty. Maybe this is a little bit more detailed concept in medicine, and the parallel could be said for anything, really. Someone may want this piece of content. And again, check out the video length. We're going for small videos that really jump in, explain a concept, and jump out. And then you can get into very detailed concepts, and this is something about contractility and pressure volume loops, and the cardiologists in the group can appreciate the concept here, but it's a very nuanced concept that is actually very relevant at the bedside when we're talking about inotropy or chronotropy. And so these video stills are essentially to explain how we can drill down in terms of level of complexity, and people can get to whatever level they want when they want it. They don't need to go back at the beginning and get to this after an hour-long or 2-hour-long lecture, right? They can jump in and jump out. And the same is true for questions. You can get a very basic question. Here's, again, harping on cardiology, but here's, just where are these structures located? And you can get a more nuanced question about myocardial infarction. And so any sort of medical content, we can kind of identify what the high-level issues are and then drill down into the details and give people that exact, discrete chunk of knowledge that they're looking for. So it's a beautiful sort of system that allows for that. And that's what I mean by personalization. Of course, we still offer text, and we can go to kind of authorities like CDC and National Library of Medicine for text-based information. So for folks that don't want to see it in a video, they can read it. And we also allow games. And this is actually one of the most exciting parts of our platforms, is that we have something called scratch pads. And you can, I can certainly sit here and tell you, the compression rate and where your hands ought to be for CPR, or I can just have you play this little game and in 2 minutes see if you're able to figure it out and make this little avatar survive. So this is the personalization. Each little discrete concept is explained in one of 4 ways, either a game, a video, a question, or some text. So there's this idea of mastery-based learning, and I'm running through information quickly, but what I want you to focus on is the beauty of this approach, and this is the learning dashboard. The idea here is that, take myself, for example. I was a medical student back in 2002, 2003, and let's say I took a course in anatomy, and let's assume I got a B or an A in that class. If you gave me that same exam today, I can guarantee I wouldn't get a B or an A because I haven't actually studied. I don't know that material. I certainly don't use it day to day. So that's not an accurate reflection of what I know. Now, in math, and this is specific to math, what we've been able to do is something very exciting, which is we've created this learning dashboard which allows people to say, okay, what do I actually know today? This person has dark blue squares where they've mastered concepts, light blue squares where they haven't mastered a concept, and gray where they haven't started. And the idea is that they're able to keep on top of what they actually know today. And if they actually start forgetting or they start getting questions wrong, then it goes back to light blue from dark blue. So you can actually backslide, and you can identify where you're backsliding and actually focus your efforts there if that's something you want to make sure you don't forget. So this learning dashboard then is very exciting because this is a snapshot of what someone actually knows today. And that's incredibly powerful and important in medicine, right, where things are ever changing. People are always kind of forgetting things they're not using. So this is a very, very critical piece to the Khan Academy platform. It really makes it stand out from a place where you literally could otherwise, you'd imagine, just go and take a class or something and forget about it. We don't really allow you to forget information that you don't want to forget. It's a beautiful aspect of the platform that I wanted to highlight. Another key point, obviously a lot of the people in the room are probably data wonks like myself. We care about data, we think about data. And this is a snapshot of how you can actually look at a classroom in terms of time spent. You can see that the person in the middle here is actually spending a lot of time doing the activities, the exercises and videos and scratch pads, and some of the other the students are not. So you can actually take a quick look that way. You can cut it by exactly what people are working on in terms of what they're struggling with and what they've worked on and doing well on. You can also cut the data by the class and say, okay, well, look, some students are doing really well with all these dark blue rectangles, and some are struggling, like Elizabeth down here with a red rectangle. And you can actually then allow students in the classroom to partner up, find each other, help each other out, and so a teacher doesn't have to be the only bottleneck on help in this situation. And, of course, you can cut the data by the content itself. You can say, wow, students are doing really, really well in the multiplication division concept, but over here, down here with mathematical reasoning, a lot of folks either haven't done it or are struggling. So lots of different ways to cut the data. And this is important because, actually going back a slide, the coach is literally kind of overseeing what the student is doing. So a coach can actually check in on a student. It could be a father, mother, grandmother, or it could be a teacher or a community member just checking in and seeing what a student is working on, and can look at what their entire group of students then is working on as well. So all of this kind of builds up to this idea of interactive learning. And we're going to see this in action in the hospital setting and what that means. But the idea is basically you remove all that information download activity out of the classroom. That can be really well done online. And instead in the classroom, you make it interactive. You turn a classroom that looks like this, where the red blob could be, let's say, myself standing in front of a group of students that are blue, and you turn it into something much more dynamic. You have a group of students that may need a review that one teacher can work with, a few doing an independent study, a few working on a group project. You essentially allow students to then move into much more interactive stuff. And in the hospital setting or the classroom setting for medical or nursing school, then these are the kinds of activities that I would like to see students doing. Working on a simulation, working down in the microbiology lab. I'm biased as an ID guy, but doing things at the bedside. And it's no longer enough to understand how dialysis works, as you all know. We have to understand, how did this gentleman in the bottom left, how did he get to the dialysis center that day? Did he have to take a bus? Is he on food stamps at home? How is he going to cook dinner that night if he has, no use of his left arm? So these are the issues that matter in people's lives, and I think what medical school, nursing school, and other schools ought to be kind of focused on then is three things, really. One would be apprenticeship, allowing practice and practicality in terms of how you apply what you're learning theoretically. Two would be networking opportunities, allow students to actually network and create that wonderful, rich assortment of connections. Three would be mentorship, strong mentorship. And this allows opportunities in research. It allows opportunities in public health. All sorts of things that you would otherwise not have time for come front and center. And probably the most important thing that comes front and center is putting empathy and compassion and humanism kind of back into the spotlight. allowing students to really grapple with how to connect with patients, something that we at the moment kind of have sidelined because of the fact that, time is limited. So that's really what Khan Academy is really all about, is really making the human piece more available in the classroom so we have time for it, and allowing the online learning to take over the information download piece. So an exciting opportunity here we had with Robert Wood Johnson and AAMC and Khan Academy, the three kind of groups all interested in this model of learning. And we thought, what a great opportunity with the 2015 NCAT coming along to allow all this information to be hosted for free online with questions and videos. And you can see all the bullets down below with all the different content areas that we now cover. And so we're working through this. And the model is basically we run a competition where we identify the best content creators across the U.S. We had hundreds of videos come in, identify these folks, we have them make content, and the AAMC is reviewing that content to make sure it's factually accurate. And once we have that accuracy check in place, we host it on Khan Academy's platform. So, these three groups, all pretty exciting, in the space, and decided to work together, and I'm glad to be part of that. And we're also doing something very similar now with clinical content for nursing content. The NCLEX exam, which some of you may be familiar with, is our next big project. So that's another exciting opportunity for us. So these kinds of opportunities are growing out of what the platform offers us. And so I'll end on this slide. I'm excited and happy to take any questions, but this is kind of the goal, a free world-class education for anyone, anywhere. Thank you, Darsha.
Thank you. Thanks very much, Rishi. What I'll do now, if it's okay, if you can hang on the line, is just briefly show sort of what we've done together for the health policy educational component, and then we'll be able to take a few minutes of questions if that's okay.
I love it. Yep.
Terrific. So what I've done is, hopefully this will just open up, just recorded a quick video that just is going to briefly demonstrate how Khan Academy works. So this is the Khan Academy website. You go to khanacademy.org. You can create an account, either sign in with Google, Facebook, or create your own account. I've signed in here as Darshak Sanghavi. And you can see you go up to Learn, up on the left, and you can learn about whatever you like. And if you go to Partner Contact, there we are, the Brookings Institution. And you click on that, and it'll bring up the new project site. So we'd love if you would do as much as you can with this. This is it. So this is the Merkin Initiative at the Brookings Institution, partnering with the Khan Academy. And we say that it's a little difficult to read, but our tagline and our mission is that developed for clinicians, as well as the general public, these engaging tutorials provide an overview of the U.S. healthcare system and payment and delivery reform. And there is the first of what we hope will be a large library of videos. This is 10 videos, again, done all in the Khan style. You can see here is a list of the topics, and it may be difficult for you to read, but the first is Introduction to the U.S. Healthcare System, Medicare, Medicaid, the U.S., why do we have people who are uninsured, and so forth. And this is what the videos look like. You click on it. Again, we're keeping it very simple. They're each 10 to 15 minutes, bite-sized chunks for the generation that we live in now to get at all this stuff. And the strategy we use is it's very chatty. It's essentially just me talking to you. And we find that things that are overproduced, those things generally don't resonate as well as people that just talk to you. Again, making that human connection. You can see this is the first video. When you scroll down, people can ask questions. We've gone live for less than 24 hours, and people already have questions. And there are already people who in a community are asking them of each other. And this is how the tutorials start. Click on it, and this is going to explain what Medicare is.
So we're going to talk about Medicare. Huge federal program, almost $500 billion a year in expenditures, almost 14% of the federal budget. Huge, complicated program.
And then that's how it starts. So that's all it is. It starts out, that's Medicare. And then we start with an actual patient. And each of these are quite narrative. We go through with patients and we explain, well, what is Medicare? How do you get it? What is this Part A, Part B, Part C business? And it goes through in a way that really anybody can understand. I'll just turn the audio back on so you can, it's a little bit difficult to view just because of the way it's projecting here, but people can see it a little better on the webcast, I think.
The private health insurers would then pay your doctor,
Yeah, it's a little
or
dark.
they might go ahead and pay your hospital. And in return, Medicare went ahead and paid the premium of that health policy to make sure the federal government will pay at least half, and in some cases more, of those costs.
So this one right here, again, it's not projecting great, it looks like, but what it does, I'm sorry, oh, you can see him up there. Oh, perfect, perfect. We'll have to upgrade our LCD projector here, thanks for that. But what this does explains what is Medicaid. So this is the next tutorial. What is this whole federal-state partnership? Who actually decides who gets on Medicaid? How does it actually work? Again, lays out the basics. I think as Phil Galewitz pointed out in an earlier panel, a large number of Americans have no idea what Medicare and Medicaid even really do. And I can tell you, as a physician educator, I'm on the faculty at University of Massachusetts Medical School, most residents were not able to accurately describe the difference between Medicaid and Medicare. Sort of scary news for most of us that work in health policy. And addressing these gaps, we believe, is the first step to engaging them in making the system better. If we believe, as Rishi said, that healthcare really is at its heart a personal enterprise, a physician and a patient, or a set of providers, nurses, and patients, if we are really going to try to bring this policy down to that level, we need to first educate people about the basics. It's the fundamental underpinning of any large enterprise, is that you have to make sure that all of you share a common series of understandings and facts together. So I'll let this finish running through for just a few minutes. This one is about understanding your medical bill.
Bundling services together like this by assigning value to the physician, there's nothing for patients to worry about in terms of bargaining for price.
So here, using a narrative case, we've sort of explained what is a medical bill. How does Medicare actually bundle those services together? What's a DRG, RVU?
Hospitals and the federal government. Because
So I'll go ahead and just click through because I want to leave time for questions. This is the chronically ill.
So this is where our patient just needs a little bit of extra time. Maybe she's had an operation, she needs some recovery. Again, hospital is not the best setting for her, but a skilled nursing facility where she gets intensive nursing support there might.
So I just cut that off. And then finally, healthcare costs, why are they so high? Here, again, trying to use narrative explanation as well.
Complex, and so I think it's best to go ahead and start with a patient story to try and understand the problem, and then also some of the solutions that have been proposed for healthcare. Look at this, it's going to get all these bills. It's going to get one bill here, one bill from here, one bill from here, one bill from here, one bill from here, and then after they return to the primary care doctor, yet another bill. Look at that. That's 1, 2, 3, 4, 5, and 6 separate encounters, 6 separate kinds of bills. You can see this care is highly fragmented in terms of how the costs are being accounted for, the bills that are being sent, and in fact, there's also not that much incentive for any of these people to talk to each other because they all just send their bills in isolation. This causes a lot of problems for our patient, and this type of billing, where everybody sends their own bills, those bills get paid, is referred to as a fee-for-service system. And
so you get the idea about sort of how we go through each of these concepts. And what I'll close with and just show you here is, in addition to those video tutorials, we developed a series of exercises. Here it asks, well, which of these is not true? There's an inline help system to make sure that at least the learners get an adequate basic amount of knowledge. In some of the other exercises, you're asked to make a timeline of when was Medicare passed, when was the Affordable Care Act passed, just basic things to make sure, again, that the learners, in this case either the general public or clinicians of any type, again, share a common language. Once you understand at least the basics of Medicare, Medicaid, what is an accountable care organization? What is this thing we call a patient-centered medical home? Why are there people who are uninsured? Then we believe you are empowered and then would take an interest in these other topics. What on earth is a bundled payment? How can that actually make care better at that point of service where you're talking to a patient, because we believe that can happen. That is actually a critical thing to happen, but we need to make sure that we bring people there. So again, I'll just close with this video demonstration just so you can finish up. But again, this is open to the public. It went live just yesterday. You're probably the first group to learn about it. You can go to Khan, K-H-A-N, academy.org, and you can find our content very easily. In the coming weeks and coming months, we will expand this. So our next series of tutorials that are planned are fixing healthcare. How do we fix how we pay doctors? How do we fix insurance? How do we fix a variety of areas around medical care? The next tutorial after that might be an introduction to the Affordable Care Act. What is this massive new law that we passed a couple of years ago? Again, explaining that in very basic ways to create that common language. So with that, I'll close out this video, and I know that Rishi hopefully is still on the line here, and we'll open it up. We can turn the lights on and take just a couple minutes of questions before our break. Let me just make sure. Do we have Rishi still on the line?
Yeah, I am indeed. Yep.
Terrific.
I was listening intently. Yep.
All right, please.
I'm Dr. Caroline Poplin, a primary care physician. In any of this, in which you sort of present things as facts, do you talk about the fact that in other developed countries there are different systems that are based on fee-for-service where and aren't centralized into ACOs and PCMHs where they get care that's as good or better at costs that are lower?
Right. I can't help but feel there's an agenda behind that question, but
why would you think
that? But I think that, again, let me just emphasize, we're really getting to the basics here. I think, again, that those types of issues you're raising, at least in my opinion, are very important. And I think, Rishi, you can also comment, Khan really has an international audience, right? So ideally, at some point, we are going to be addressing how other countries also take care of patients, right?
Yeah, so there are 2 points here. One is that obviously, as Darshak just mentioned, as we roll out content, an important piece is going to be kind of a comparison between different countries. Clearly, the U.S. is not the only way to do things, and there are many other successful models out there to learn from. The other piece I'd like to throw out there is that obviously with 10 million unique users coming per month, these chat rooms or forums become really rich, and very often, I'll go back to a video I posted, and there will be a very robust conversation that goes well beyond what I ever would have expected. And people will say, well, I'm from Cuba, and in Cuba, this is how we do things. Or, I'm from Ghana, and in Ghana, this is what I've noticed. And so it's very interesting where the conversation goes. But the important thing is to have the conversation, right? So I think that's the key here is when you create quality content, it drives the quality conversation, kind of sets the tone, and that's what I love about it.
Yeah.
My name is Becky Haynes. I'm with the American College of Radiology. And this is such an exciting development. Thanks for putting on this session. I'm wondering if the folks from AAMC, AMSA, and the ABMS can comment on how your partnership with these kinds of disruptive technologies are working. Organized medicine is very interested in helping and providing the solution, but it's not always easy for us to work with this kind of technology and these kinds of organizations that are not in the traditional mold.
Maybe I'll let Rishi talk about that for a minute, because he's been sort of the glue that's held a lot of these partnerships together. And then if a tool from AAMC, or Lois, if you want to comment from ABMS, or Nida from AMS afterwards, that'd be great.
Darshak, I apologize. I only heard fragments of that comment or question. Do you mind repeating it for me?
She was. The question was how, as we move forward, there was a representative from American College of Radiology, I understand, wanted to know how these kinds of partnerships work and how, what sort of positive things have come out of them, possibly what lessons as well.
So thank you for asking the question. And in particular, in radiology, we are looking for good partners. So after all this is over, if you're interested, shoot me an email. I'd love to chat more offline about it. But in general, the partnerships are basically structured around strengths. We approached Robert Wood Johnson because obviously they're a big player in the game, and AAMC has a credible and neutral authority. And so we thought that made sense to us in terms of creating MCAT content or foundational content for the students entering medical school. We currently are working with the nursing board and also the Jonas Center around clinical content. We're always looking for kind of partners that meet certain criteria, and that criteria would be kind of authorities in the field, fairly neutral, and actually that's an important part of why we chose to be part of the partnership with Brookings Institution. We hope that the opposite is true as well. We saw them as kind of a credible authority in this space, and we wanted to tap into that expert knowledge. And so we know we have a certain tool. I think our strength is the platform, but there are lots of other pieces that we need, and so we're always looking for good partners that would want to work with us.
Terrific. We're running a little short on time, so I think we have time for one more question, and then we'll go into the break.
Rishi, it's Howard Bachner. Sometimes we make these assumptions that new technology is better. Oftentimes we make these assumptions that just new technologies, kind of because they're sexy, are better. It was interesting to hear you describe this as more personalized learning. I may have thought some people may have described it as much less personalized learning. We have an educational issue, and we really we have a hard time finding high-quality studies that really say a new educational initiative is better, not just sexy. Do you have any goals in studying whether this is better? Because there's cost implications. There's a lot of other things that you haven't really addressed. So I'm just interested in your evaluation of whether this is truly better. You obviously think it is.
Yeah, and may I ask, is that Howard Bachner, or who's that question coming from?
Sorry, yeah, so that was Howard Bachner from JAMA, who is raising the specter that we may need to provide some kind of evidence.
Sure, yeah.
Yeah.
The reason I knew that without seeing him is because Howard is my former boss. Having said that, so, you bring up a good point, and we shouldn't just take things on faith, obviously, and so we are actually very interested in understanding how this can be utilized in the classroom. We make no claim that this is in any way better than what we currently do, and I hope I didn't come across saying that. What I do think is that we have a few interesting data points or proof points to look at. One is the use, and we are getting a lot of use, and that's interesting. That's not to say that means that it's better, though, and we are actually taking a very critical look at how effective this platform is in math. And we are actually working with an outside organization to do a careful evaluation of how effective this strategy is, again, in math. In medicine, we're very early on, and we have very little content at the moment relative to where we need to be. And so I think it's very early stages, and I don't want to make any assumptions about whether it's better or not. I really hope I didn't come across saying that. But thank you for the point. That's a very, very important point.
All right. Well, thank you all very much. We're a few minutes over, so we'll go ahead and take a little bit of a break and reconvene at, I believe, 11:15. Thank you very much, Rishi, for joining us. This has really been fantastic. Really appreciate it.
Absolutely.